So my name is Elizabeth Acheampong. I'm the Senior Technical Advisor for Maternal, Newborn and Child Health in the U.S. Government Integrated Health Partnership Project. I graduated from the College of Nursing. No, so it was a department then. From the department, I graduated from the Department of Nursing in 2009. And whilst in school, I was at the Queen's Hall. So, what key lesson from your time at KNUST has shaped how you approach your career and life today? So, the key lesson I learned that has really shaped me was for me to take my practical lessons very serious. As a nurse offering, as a young undergrad offering nursing, practicals was something that I had to take seriously, and that's really shaped me. Looking back, what moment at KNUST still makes you smile anytime you think about it? So, what makes me smile is the sweet memory I have when I met my late husband whilst I was still a student here. What is one health related misconception you believe the public needs to unlearn? So, there are several health related misconceptions that we need to address and that the public needs to unlearn. And the most popular one has to do with misconceptions about pregnancy. You need to eat this, you don't have to eat those. There's a lot of education that we need to do so that the public get to know that these are just myths and misconceptions, and there are positive things that you have to do during pregnancy to ensure you have a safe mother, and then you have a healthy mother and a healthy baby that will thrive. What advice would you give to both young professionals and seasoned alumni about staying relevant in today's health sector? For me, what I will tell them is to keep learning, to make themselves relevant, and they should build their mental health resilience. They need to be very resilient because life outside there is not easy now. Once you graduate and you leave the walls of KNUST, virtually you are an adult. You are going to face the challenges of this world. You need to be very resilient and you need to learn, improve your CVs so that you remain relevant in the health sector. What is one habit that has helped you maintain excellence in your field personally or professionally? So I've always acted as a professional. Our job has to do with life or death. So punctuality at work, and then reading, learning, being flexible, open to suggestions, saying no when it is no, and above all, taking very good care of my patients. If you had to describe the spirit of KNUST in one sentence, what would it be? Resiliency. Resiliency. What was the turning point in your journey that confirmed you were on the right path in health sciences? For me, the turning point was when I had to leave bedside nursing and do other health related things. So it's not just what you learn in school. There's so many you can do out there. Nursing is not just about being at the bedside. You need to be very innovative. You need to explore other avenues. So for me, living bedside nursing has been good, and that was when I realized I was on the right path. What is one thing the KNUST community students, alumni, and staff can do to better support the future of healthcare in Ghana? I think one thing that we can do is to do a lot of implementation research, be interested in data, use data to take meaningful decisions. I think if we are able to do that, we can strengthen the future of healthcare in Ghana. If you were to relive one experience from your campus days just for the fun of it, what will it be? There were days that I mean, there were instances that I had to skip lectures. Yeah, I did that. I think on 2 or 3 occasions. Especially when I was having my second degree because I was working and schooling at the same time. What final message would you like to share with the entire KNUST community as we celebrate this graduation? I want to just say a big congratulations to um, the staff of KNUST for producing um, good brains that are supporting the growth of this country. Thank you very much.